cleft lip and palate are congenital birth defects that affect the formation of a baby's lip and/or mouth during early fetal development. A cleft lip is a split or opening in the upper lip, while a cleft palate is a split or opening in the roof of the mouth. Sometimes, these conditions occur together. Cleft lip and palate occur due to incomplete fusion of the facial structures during pregnancy, typically between the 6th and 10th week of gestation. The exact causes of these conditions are not fully understood, but they are thought to be influenced by a combination of genetic and environmental factors. The impact of cleft lip and palate can vary in severity, ranging from a small notch in the lip or a tiny hole in the roof of the mouth to more significant clefts that extend into the nose and affect the structure and function of the mouth and palate. These conditions can affect a child's ability to speak, eat, breathe, and even hear properly. Apthous ulcers, also known as canker sores, are small, painful sores that develop inside the mouth. They are one of the most common types of mouth ulcers and can affect people of all ages. Apthous ulcers are usually round or oval shaped with a white or yellowish center and a red border. The exact cause of Apthous ulcers is not fully understood, but it is believed to be multifactorial. Some potential triggers and contributing factors include trauma, accidental biting of the cheek, tongue, or lip, aggressive brushing, or dental procedures can cause tissue damage and increase the likelihood of developing Apthous ulcers. Immune system issues. Certain immune system disorders, such as autoimmune conditions like celiac disease, inflammatory bowel disease, or HIV/AIDS, can make a person more susceptible to Apthous ulcers. Nutritional deficiencies. Inadequate intake of certain vitamins and minerals, such as vitamin B12, folate, or iron, may increase the risk of developing these ulcers. Hormonal changes. Some individuals may experience recurrent Apthous ulcers during hormonal fluctuations, such as during menstruation. Apthous ulcers typically go through stages of formation, ulceration, and healing, with each stage lasting about 7 to 14 days. The symptoms can vary in severity, ranging from mild discomfort to significant pain that can interfere with eating, drinking, and speaking. Behcet syndrome, also known as Behcet disease, is a chronic and rare autoimmune disorder characterized by recurrent oral and genital ulcers, as well as inflammation in various parts of the body. The exact cause of Behcet syndrome is not fully understood, but it is believed to involve a combination of genetic and environmental factors. It is more common in certain geographic regions, including the Mediterranean, Middle East, and Asia. The condition typically affects young adults, with the onset of symptoms occurring between the ages of 20 and 40. The hallmark symptom of Behcet syndrome is the presence of painful oral ulcers, which may be recurring and can affect the lips, tongue, and inside of the mouth. Genital ulcers, affecting the scrotum in males or vulva in females, are also common. Additionally, individuals with Behcet syndrome may experience other symptoms such as skin lesions, eye inflammation, uveitis, joint pain, gastrointestinal problems, and central nervous system involvement. Behcet syndrome is a systemic disease, meaning it can affect multiple organs and systems in the body. Inflammation can occur in various blood vessels, leading to complications such as blood clots, aneurysms, and inflammation of the brain or spinal cord. This can result in serious health issues and require immediate medical attention. Treatment for Behcet syndrome aims to relieve symptoms, control inflammation, and prevent complications. Medications such as corticosteroids, immunosuppressants, and biologics may be prescribed to manage symptoms and reduce inflammation. Additionally, supportive therapies may be used to address specific organ involvement, such as eye drops for uveitis or mouthwashes for oral ulcers. Oral herpes, also known as cold sores or fever blisters, is a common viral infection caused by the herpes simplex virus type 1, HSV1. It is characterized by the formation of small, painful blisters or sores on or around the lips, mouth, or gums. Transmission. Oral herpes is highly contagious and can be transmitted through direct contact with an active herpes lesion or by sharing personal items such as utensils, towels, or razors with an infected person. It can also be transmitted through oral genital contact, leading to genital herpes. Symptoms. The initial outbreak of oral herpes may include symptoms such as tingling, itching, or burning sensation around the lips or mouth. Small, fluid-filled blisters then form, which can be painful and may rupture and crust over. Other symptoms can include fever, sore throat, swollen lymph nodes, and general malaise. Recurrence. After the initial outbreak, the virus remains dormant in the body's nerve cells and can reactivate periodically. Recurrent outbreaks are typically milder and shorter in duration than the initial outbreak, and they are often triggered by factors like stress, fatigue, sunlight exposure, hormonal changes, or a weakened immune system. Diagnosis. Oral herpes is usually diagnosed based on the appearance of the lesions and the person's medical history. In some cases, a healthcare professional may take a swab from a blister or perform a blood test to confirm the presence of the herpes virus. Treatment. There is no cure for oral herpes, but antiviral medications can help reduce the severity and duration of outbreaks. Over-the-counter creams or ointments may provide symptomatic relief. It's also important to keep the affected area clean and avoid triggers that can provoke outbreaks. Prevention. To prevent the spread of oral herpes, it is important to avoid direct contact with active lesions. You should also avoid sharing personal items with an infected person, practice good hand hygiene, and avoid oral genital contact during an outbreak. If you suspect you have oral herpes or have any concerns, it is best to consult a healthcare professional for an accurate diagnosis and appropriate treatment options.